I'm Ron Gallagher at Maximum Velocity Physical Therapy, and you're listening to HYPERSPEED Radio. You don't have to live in pain, whether you're running, swimming, playing a team sport, or just everyday fitness. We bridge a gap between medicine and strength and conditioning to help you break through at MVPT. Hello. Welcome to HYPERSPEED Radio, episode 15. Today, I'm Ron Gallagher, and today I'm going to be discussing Ron's rant on, technically it's on Ehlors Danlos syndrome, but this topic will touch any of the hypermobile type ailments that people get, including dancers, yoga. But so I just discharged this lady, and she highlighted a really, really big hole in the way that these types of people are educated. So I wanted to do my best to fill in that hole. If you don't know what Ehlers Danlos syndrome is, it is defined as a group of inherited disorders that affect your connective tissue, skin, joints, and blood vessels. Connective tissue is a complex mixture of proteins and other substances that provide strength and elasticity to the underlying structures in your body. Typically, these folks are female and are diagnosed somewhere between 15 and 19 years old. The symptoms are joint hypermobility, easily dislocated joints, pain, clicking of joints, and can't read my writing. And chronic fatigue. The hole in the literature is that this is something that people get. Like, this is something that is passed on from generation to generation. And the last 15 that I've had with this diagnosis have not been anywhere near that. What's frustrating about this type of medical diagnosis is it's what they call a bottom of the barrel diagnosis. It means that they've tested you for all these other things and they can't find anything else. So they pigeonhole a person. So then a person says, this is something that is affecting me. I'm going to go research it. They see themselves in the research. They go to these patient meetings and they support groups, and they essentially talk themselves into having a problem like this. I took a picture of one of the websites that I went to, did a bunch of research to help me with this. And this is what the website says with regard to living with Ehlers Danlos syndrome. It makes me nuts. It's important to be careful about activities that put a lot of strain on your joints or put you at risk of injury. But it's also important not to be overprotective and avoid living an otherwise normal life. Advice will depend on which type of EDS you have and how it affects you. You may be advised to avoid some activities entirely, such as heavy lifting and contact sports. For some activities, you may need to wear appropriate protection and be taught how to reduce the strain on your joints. Lower risk activities such as swimming or Pilates may be recommended for you to stay fit and healthy. If fatigue is a problem, you can be taught ways to conserve your energy and pace your activities. Ladies and gentlemen, the reason why a person has this problem is if they follow this instruction. It makes me absolutely crazy. Here's what's happening. A person, no doubt, will have pain. And when they're in pain, if we start with say, a general practitioner, and the general practitioner runs some tests and they don't find anything wrong and there's no reason or rhyme to the pain, and they start talking about, all the flexibility tests that a person can take, and they're positive for flexibility, then they get them on to these specialists, and the specialists can't find anything else wrong, so they give them this particular syndrome. Well, if they ended up at a physical therapy clinic who is educated in pain science and can adequately share with them how hypermobility is related to weakness and how weakness influences your everyday activity. And if your everyday activity is so low, you're going to get fatigued. And if your activity doesn't include anything that's going to make you feel uncomfortable, then you're, of course, not going to be strong. And if you're not strong and it starts to spiral on itself, you find yourself over-flexible, over-mobile, understable, and understrong. In previous episodes, I've talked about mechanotransduction, which is the body's ability to react to the stress that's placed on it. And if you remove stress from any of these hypermobility type of problems, they get more hypermobile. So the behavior that the person has is a result of the poor education they get from the medical system. And they continue to move the same way, and they continue to get these same types of problems over and over and over. And eventually, their connective tissue responds to the lack of stress. And the lack of stress is what's causing the connective tissue to go the opposite direction of strong. The last 10 or 15 patients that I've had have had amazing outcomes by adequately building strength, adequately loading a barbell, and eventually after 4 or 6 weeks of progressively loading, they start to get far less symptoms, able to do more and more things as a result of challenging their connective tissue in a way that adds connective tissue and makes their joints less hypermobile, and they don't get any fatigue because they're training and getting adequate rest, and they're completely reversing all of the symptoms of Ehlors Danlos. 15 and 19-year-old is when it's most diagnosed, and that's because puberty and how our connective tissue grows in response to puberty and how our activity is as a young teenager and how the behavior that we have is leading them down this cycle of less activity, more hypermobility, more pain, less activity, more hypermobility, more pain. By reversing that cycle, building some foundation strength, teaching this connective tissue how to tolerate normal loads and progressively loading those joints, they become more and more stable. If we review connective tissue, we know that if we look at connective tissue in a microscope, that healthy connective tissue will have very uniform connective tissue orientation. In somebody who has pain, somebody who has hypermobility, those fibers are oriented in a random fashion, and the random fashion is less stable than along the line of force. So by progressively loading the connective tissue and asking this connective tissue to respond to the stress that is placed on it, the connective tissue fiber direction changes towards the angle of load, and the load changes all the symptoms. So the last person that was in actually did really, really great. She was deadlifting, I think, 105 pounds, 115 pounds. We'll be able to tell from the video. By the time this video was taken, she's actually increased that load now by 20 or 30 pounds. She is putting heavy barbells above her head. She presented with neck pain, shoulder pain, back pain, upper rib pain, lower back pain, hip pain, knee pain. Not only is she pain-free, but she's lifting the heaviest she's ever lifted in her life. No one's ever told her she could do that. In fact, just like this website said, avoid heavy lifting, which is dumb. You need to be lifting. She also always dreamed of becoming a rock climber, and now she's able to climb rocks. So DJ Trav, let's hit that video, please. So here she is, deadlift. She actually started with a kid's bar and 5 pounds on each side. This is actually a women's bar, which is a progression from the kids' bar where she started. Actually, she started with 4-pound dumbbells above her head, and that's probably 55, 65 pounds there. She was so excited, she was able to climb for an hour straight. This is one session of her climbing, and she is getting into routes that she never was able to get onto. She also can do it with no pain. She also is able to do it again tomorrow if she wanted to. So I sped it up, otherwise it would be really long, but she was particularly excited about the muscles in her back. She'd never seen those before. And she's got hips, knees, shoulders, neck, back, all going in different directions, doing things she's never thought she should be able to do. And it was 100% related to her ability to move a barbell, especially off the ground. So she will squat, she will deadlift, and push press. So she's putting something heavy above her heads. Pretty exciting to take somebody who completely believes she'll always have pain to maybe I can do something to help her, even if it's just 5 or 10% better, and help her develop the strength and the stability to be a pain-free person, and then a pain-free person who can climb. And she's especially excited about the example she can be for her kids, that she can put in some work and she can do hard things. So it's been a really great emotional journey, and she's probably the 15th woman I've had this experience with this particular problem. And this has been the result across the board. Yeah, look Look at her go. This is sped up by twice, just so you know. So she's not climbing that fast. But no knee pain, no hip pain, no back pain, no neck, no shoulder. Oh, missed one. My bad. That's why I hit the mute on him. She actually has a coach shouting instructions. Music playing in the background. Awesome. So happy for her. The take-home message here is you are not your diagnosis. You are not just grouped by symptoms. And sometimes support groups actually facilitate people not getting the information that they need. And for hypermobility problems such as Ehlers Danlos, but the same thing happens in dancing, same thing happens in yoga, same thing happens in any in people who overutilize massage. The connective tissue is responding to the stress placed on it, and if you have made up your whole day based on what this affliction has told you should do, then you're just going to move within the parameters that has set for you. And finding a physical therapist who can change your connective tissue properties, give you the skills and the knowledge to be able to move something heavy off the ground, you will be more than excited with your results. And this is not an uncommon response in the clinic. And I wish more people knew that this was an option. And I would jump at a chance to help any groups or any individuals who are being limited by the education that they got and don't even realize it. But there is other options, and it's lifting something heavy for sure. So without further ado, I'm going to cut this one. And this is Hyperspeed Radio, episode 15, hypermobility syndromes like Ehlers Danlos. And that's all for today. Peace.